Welcome back to the Morning Blend. Well, dentures are one of the oldest methods for replacing teeth, but they have their downsides. They can slip and slide, they can affect your experience with food, and they can also become loose and fall out. But now advances in technology offer multiple alternatives that greatly improve your quality of life and your smile too. So here to tell us more is Dr. Christopher Hickson from Wisconsin Smiles and Dr. Anthony Raganese with Wisconsin Oral Surgery to tell us how they work together with dental implants. Nice to have you gentlemen on the show. Good morning.
Thanks for having us.
Absolutely. Let's talk a little bit about what's new and exciting, in your opinion, for people who need to replace teeth.
Well, you can no longer have to really wear those dentures where you have problems with being loose, flopping, have that consciousness when you go out to eat, that sort of thing. So the advances is the implants are a very good alternative and option to have. We have several options, but it's a very good opportunity for them to get rid of those fears.
Mm-hmm. Is it painful? I think that's a question that a lot of people have.
No. Like any surgery, there's a certain degree of discomfort you can expect, but in general, it's really not a painful procedure at all.
Let's talk about the options. If you kind of leave them put on the table and describe how they work, starting with maybe this one right here as we turn it kind of toward the camera. How does that particular implant work?
This is an all-in-4 case, which is essentially that's a denture that it's called a fixed bridge, where it's basically screwed in. So the patient can't remove that prosthesis. So they can go back to eat pretty much anything that they ate before they lost their teeth.
Do they have to have a certain amount maintained in their mouth in terms of maybe either bone or tissue in order to be a good candidate for that?
Sure. There needs to be a minimum amount of bone necessary to perform any of these dental implant related procedures. But this particular option, this all-on-4 option, or this tooth in a day or teeth in a day concept you may have heard of, there is less bone requirements than some other approaches.
Is that one of the reasons that makes it an advantageous or beneficial option?
Absolutely.
And it can be done in a day?
Absolutely.
That's going to be shocking to a lot of people to hear.
Sure.
Why are you able to do it so quickly?
It's just the way the technique was developed, and it lends itself to a very straightforward surgical procedure, a very straightforward restorative procedure. Patients tolerate it extremely well.
And how durable is it? If someone has that type of implant, how long can they expect to have that in their mouth and have it working and be healthy for their tissue and gums?
It could last forever.
That's amazing.
Yep.
What are some of the other options then?
The second option is, if we remove this, I can show you that. The second option is that if they maybe choose, based on what you had talked about and Dr. Raganese talked about, if they didn't have enough bone, they also have an option that they can have maybe 2 implants placed. It works a little bit differently. It's a snap-on denture. They still have to remove it.
Go ahead and snap that on. So that's something that's removable.
Correct.
Okay.
Yes. And so you have a nice snap to it, but they do have to remove that.
Sure.
The third option is they could go down the line again, and we have some sort of, I'll take this off so they can see that, some sort of what we call mini implants. They work very similar to the traditional implants, just a little bit differently. So,
can you replace individual or a few teeth, or does it have to be the full set?
You pretty much, you can do individual teeth, yes.
Okay.
A single tooth.
Go ahead and put that on so that we can see how, so that again snaps on, but that's permanent?
Right.
Okay, so again, that's a permanent option, not something that's removed. What are the success rates with these different options?
As far as implants are in general, implants enjoy a 98.6 success rate, so they're very successful.
Yeah.
Sure.
Do you think that a lot of people, when you talk to them about this, are surprised that it's more affordable than they expected?
There's no question. There's no question. Many patients will ask us, of course, and ultimately, what is this going to cost? And when you relay that to them, they're very shocked. They thought it would be so much more expensive. Yeah.
Yeah, that's incredible. And I think a lot of people will see this and go, why isn't everybody doing this then?
Great question.
Is it just that not every doctor or dentist out there is doing it?
That's the million-dollar question, and it's really, I think, Dr. Raganese and I, if we could find a way to communicate that in our over 50 years of doing dentistry, there's not one case that we've ever had the patient, oh gosh, I wish I didn't do that. And so, you know, I think the other thing we have to take a look at is that people have to kind of grasp that it's definitely a life-changing process that goes on there.
Oh, I'm sure the smiles you get and the thank yous you get
Very
are well
rewarding.
worth what you're doing, especially to be able to give people so many different types of options. And right now, you're offering a free exam and CT scan, which is incredible. And you can see, as we're saying right there, the value of this free exam and CT exam is incredible. And you can call right now to make an appointment and to find out more about the different options that you have available. 414-982-3676, or you can visit Wisconson Smiles Dr. And be sure to mention the Morning Blend and ask for that free exam and CT scan, which is of the head, which helps you, I know, decide on the right option for people.
Sure.
Nice to meet both of you. Thank you so much
Thanks
for
for
your
having
time.
us.
Appreciate it.